Ever heard of Ouabain? No? I didn't think so. It's also known as G. strophanthus. Did that help? Probably not. Hi, everybody. I'm Dr. Mitch, and today I want to discuss a little something that you may not know about, but extremely important hormone from the adrenal glands that few, if any, have ever heard about. And its potential is major importance, especially in cardiac health. Actually, Ouabain is a cardiac glycoside and basically a tonic for the heart. The adrenal cortex is the most primary area where circulating Ouabain and aldosterone are biosynthesized. And now studies show that a low dose of angiotensin II acting with the CNS, the central nervous system, upregulates circulating Ouabain, basically. This in turn stimulates downstream arterial monocyte mechanisms that lead to vascular tone and long-term blood pressure. However, it's interesting to note that digitalis, a close cousin to Ouabain, was found regularly in neonatal plasma. Ouabain is a cardiac glycoside. It's a compound that we find in some plants, and I will talk about that later because it's peculiar in African plant species known as the strophanthine gratis plant, which was originally known as a blow dart poison that the Madagascar Indians and others would have synthesized through cooking, etc. It is known for its ability to inhibit the enzyme Sodium-potassium ATPase, which this inhibition leads to an increase in intracellular calcium levels and calcium cardiac muscle tissue, resulting in enhanced contraction force involved in the cardiac output. You'll see that it's going to help the heart pump harder. Ouabain has been studied for the potential, basically therapeutic effects of the heart, including its ability to protect the heart. Yet we can't measure by typical assays, but we should be aware of, because if the adrenal glands have low other cortex hormones, we suspect that this is low as well, and it should prompt you to do something to protect your heart. It's important for you to know this cardiac glycoside that the adrenal glands produce. Just to remind you that it does come from the cortex of the adrenal glands, it seems, along with things like DHEA, pregnenolone, cortisol, etc. That's how important this is. Now, Ouabain protects the heart by several things. One is by what we call a positive ionotropic effect. Ionotropic medications is something that makes the heart contract harder, more force. It also has a positive chronotropic effect. And the positive chronotropic effect means that it helps the heart rate to be regulated. There's one other term, other than the fact that Ouabain is an antiarrhythmic. In the same time, Ouabain also acts as a positive lusitropic agent. So when you're talking about lusitropic, Lusitropic, it's a lesser understood definition. You should be aware. It's how the heart relaxes in diastole. And so it is an important component, like magnesium, like nitric oxide supplementation. So is Ouabain a positive lusitropic agent. So it has all these amazing effects. And Ouabain has an antiarrhythmic effect. So it helps stabilize the heart electrical activity and reduce basically the risk of abnormal heartbeat as well. It's been investigated as a potential way to keep the heart more resilient, healthy over a long period of time, to stop ischemic damage. Ouabain is wonderful when there is a microcirculatory disorder, which is about 46% or so of heart attacks occur in the microcirculation, which unfortunately in our typical armamentarium, in the normal medical component, we don't really have anything that could do that, but it will help. It does this by several mechanisms, Ouabain, to help us. Well, basically, there's an activation of the signaling pathway. Ouabain inhibits the sodium-potassium pump ATPase enzyme, leading to basically an increase of calcium within the cell. And that calcium increase helps that to be what Ouabain is particularly, and that is positively ionotropic, like other cardiac glycosides, specifically like digitalis. And it triggers activation of several signaling pathways. So this is an important component, not only to the prevention of cardiac disease, but also in the treatment of cardiac disease. It protects against the ischemic injury. It also is a mitochondrial protection as well. One of the critical mechanisms by which Ouabain preconditions as it protects the heart to and through the preservation of mitochondrial function. And that is extremely important. It's been shown to improve mitochondrial respiration. And of course, as you know, pretty much every disease has mitochondrial dysfunction that's associated with it, from heart disease to cancer, etc. Even the membrane potential and redox reactions of oxygen species during the ischemic events is decreased because it helps stop tissue damage caused by ischemia, as so many other things do. It's also anti-inflammatory. It has an anti-apoptotic effect, but anti-inflammatory simultaneously. Ouabain precondition can modulate the inflammatory responses and inhibit apoptosis, cell death, of course, in cardiac cells. Are you getting the picture of how important this cardiac glycoside is? So by reducing inflammation, it will stop cell death pathways. Ouabain helps to preserve cardiac function in tissues, again, in ischemic episode. And then there's the preservation of calcium homeostasis. Basically allows the proper amount of calcium to enter the cell, not too much. It helps intracellular calcium levels to be normalized, which can impact, of course, many processes, and regulates the calcium homeostasis inside the cell. And that means the contractility, as I said earlier, is also maintained. Ouabain's an extremely important component as something that will help preserve the heart and decrease ischemic damage, especially if someone has some sort of circulatory vascular disease.